We've all heard it before. Don't eat too many eggs, they'll raise your cholesterol. Or how about this one? Butter. Oh no, that's a heart attack on a plate. But what if I told you that cholesterol isn't the villain we've been made to fear? What if most of what you believe about high cholesterol is either outdated, misunderstood, or flat out wrong? In today's video, we're diving deep, really deep into what actually causes high cholesterol, not just what your doctor tells you in a 10-minute appointment. We're going to look at genetics, lifestyle, inflammation, even stress. Yeah, you heard me right, and how these all play a role. And guess what? It's not just about what you eat. In fact, some of the people with the cleanest diets still have high cholesterol. Why? That's what we're uncovering today. So grab your tea, sit back, and prepare to learn something that might just save your life or someone you love. What is cholesterol, really? Before we talk about what causes high cholesterol, let's clear something up. What is cholesterol anyway? Cholesterol is a waxy, fat-like substance. It's found in your blood and every single cell in your body. And believe it or not, your body needs cholesterol to function. Yep, it's not the bad guy. It's actually used to build cells, produce hormones like estrogen and testosterone, and help make vitamin D. Your liver even makes about 75% of the cholesterol your body needs. So here's a question: if your body makes cholesterol on its own, why do we get scared when we hear high cholesterol? Let's break it down. There are two main types of cholesterol. LDL, low density lipoprotein, often labeled the bad cholesterol, HDL, high density lipoprotein, the so-called good cholesterol. And then there's triglycerides, a type of fat in your blood that also plays a big role. When doctors talk about high cholesterol, they're usually referring to high LDL and low HDL, a combo that increases your risk of heart disease. But now here's the twist. Real causes of high cholesterol. So what actually causes high LDL cholesterol? Is it just eating fatty foods? Not exactly. Let's look at the real culprits. 1. Genetics. This is a big one. Ever heard of familial hypercholesterolemia? It's a genetic condition that causes very high cholesterol even in people who are young, fit, and eat clean. If high cholesterol runs in your family, your liver might not remove LDL from the blood efficiently. Result: cholesterol levels rise no matter what you eat. 2. Diet, but not just fatty foods. Contrary to what we've been told for years, dietary cholesterol, like the kind in eggs or shrimp, has very little effect on blood cholesterol in most people. What does affect it? Trans fats found in processed snacks, fried foods, and margarine. Excess sugar, yep, sugar, not fat. Sugar, highly processed carbs like white bread, pastries, and sugary cereals. These increase triglycerides and LDL and lower HDL. That's the real danger. 3. Lack of exercise. Exercise helps raise HDL, the good cholesterol, and it helps your body process fats more efficiently. Sedentary lifestyle =, more buildup of bad fats in your bloodstream. 4. Smoking and alcohol smoking lowers HDL. It also damages blood vessels, making it easier for cholesterol to build up as plaque. Excess alcohol boosts triglycerides, puts stress on your liver. Misconceptions about cholesterol. Let's bust some myths while we're here. Myth 1, eating eggs will give you high cholesterol. Nope, unless you're sensitive to dietary cholesterol. A small % of the population, eggs are fine. They actually raise HDL, the good kind. Myth 2, fat is the enemy. Wrong again. Healthy fats like those in avocados, nuts, olive oil are actually protective. It's the trans fats and refined carbs that mess with your cholesterol. Myth 3. Only older people get high cholesterol. Guess what? Teens and people in their 20s can and do have high cholesterol, especially if it runs in their family or if their lifestyle is poor. Myth 4. If you feel fine, you don't have high cholesterol. False. High cholesterol has no symptoms. You won't feel it until it becomes serious, like a heart attack or stroke. That's why blood tests are so important. How to lower your cholesterol naturally. Here's the good news. In many cases, high cholesterol can be managed or even reversed naturally. Here's what works. Exercise regularly, at least 30 minutes a day of brisk walking, cycling, swimming, or strength training. Eat more fiber, especially soluble fiber from oats, beans, fruits, and veggies. It helps your body get rid of cholesterol. Focus on whole foods. Limit processed junk, sugar, and fried stuff. Quit smoking and limit alcohol. Your heart will thank you. Manage stress, meditation, therapy, journaling, sleep, whatever helps. Get regular checkups, know your numbers, knowledge is power. And remember, if your doctor recommends medication like a statin, it's not a failure. Sometimes it's necessary, especially with genetics or other health conditions involved. High cholesterol isn't just about food, it's about your body, your lifestyle, your whole picture. Understanding the real causes helps you take control, and that's what this is all about. Empowering you with real, honest knowledge. So next time someone says, you've got high cholesterol, better cut out those eggs, you'll know better. And maybe, just maybe, you'll help them understand too. Thanks for watching. If you found this helpful, hit that like button, subscribe for more real health talk, and share this with someone who needs to hear it. Stay healthy, stay informed, and remember, you're in charge of your health.